Welcome to this explainer. Look, if you spend any time online scrolling through wellness or neurodivergence content, you've definitely seen these two terms popping up everywhere: sensory integration therapy and ASMR. And you've probably noticed they get confused a lot. People constantly blur the lines between an actual prescribed clinical therapy and these self-soothing brain tingles of online media. So today, we're setting the record straight, and I am genuinely so excited to dive into the truth behind these two totally fascinating sensory worlds with you. Okay, let's look at our roadmap. We're going to cover the illusion of sameness, defining the map and the tool, where mechanisms overlap, the evidence, and finally, the honest hierarchy. Kicking things off with Section 1, the illusion of sameness. At a surface level, the similarities are honestly striking. Both sensory integration therapy and ASMR use controlled sensory input. They both heavily rely on sound, rhythm, repetition, and body regulation to help a person feel significantly more settled. When you observe someone popping on headphones to calm down, it's incredibly easy to assume they're doing the exact same thing. But here's the catch. We have to ask, is that sound being used for passive masking of an overwhelming environment, or is it active neurological stimulation? Because, as we'll see, the clinical context changes the whole picture. Moving right along to Section 2, defining the map and the tool. Okay, so AIR sensory integration is not just throwing on a pair of headphones. It's a professional occupational therapy approach. It is meticulously designed around clinical assessment, specific goals, participation, and actual daily function. A therapist is looking really closely at how sensory processing affects a person's real life. We're talking getting dressed, crushing it at school, getting enough sleep, or regulating emotions. It is highly goal-directed and it is therapist-led. Now, contrast that with ASMR, autonomous sensory meridian response. This is entirely self-selected media. You choose a sound or a video simply because, well, it feels calming, it gives you those tingles, or it provides a really comforting predictability. And while it absolutely supports relaxation, which is great, it is not a clinical evaluation. Listening to an ASMR track does not create a functional therapy plan. To really hammer this home, think about an occupational therapist designing a sensory diet. They are asking a massive, big-picture functional question. What is this person trying to do in daily life, and what sensory supports help them participate? This could mean changing the environment, adding movement breaks, using weighted input, or managing sound. They're looking at the entire landscape of your life. ASMR, on the other hand, asks a much narrower, right-in-the-moment question. What sound feels good or calming right now? You might discover that low brown noise totally masks irritating household sounds, or soft tapping helps you lock in and focus. And hey, those are incredibly valuable things to know about yourself. But that narrow focus on immediate comfort is exactly why pulling up an online video is not a substitute for clinical therapy. Which brings us to Section 3, where mechanisms overlap. So the crucial point here is that the overlap is entirely in the biological mechanisms, not the clinical authority. Both involve controlled sensory input and utilize predictability. Because of that, both can successfully dial down arousal for some people and help the nervous system physically shift out of high alert. Biologically speaking, your body is just responding to predictable, calming stimuli. But there's a flip side. This shared biology is exactly why sound can sometimes backfire. If the sensory input isn't tailored correctly to you, what was supposed to be calming can rapidly overstimulate your nervous system, causing major distress instead of relaxation. All right, Section 4, the evidence. When we look at the actual research, this distinction gets even clearer. On the occupational therapy side, recent 2024 and 2025 reviews show that sensory integration really can improve adaptive outcomes, especially for autistic individuals, but they heavily emphasize that individualized care is an absolute must. Then, over on the ASMR side, the science is a bit newer but super fascinating. Research links ASMR responsiveness to heightened sensory sensitivity, and acoustic studies actually confirm that those predictable, cyclic patterns directly influence our relaxation responses. So what's the major takeaway here? The science of ASMR is totally validating why it feels good, but it absolutely does not prove it can replace individualized therapy. Let's move to Section 5, the map versus backpack metaphor. And this brilliantly illustrates exactly how we should think about these two things. Think of sensory integration therapy as your complete map. It looks at the whole person, the environment, the specific tasks you need to do, and your long-term goals. ASMR? Well, ASMR is just one tool that you carry inside your backpack while you navigate that map. It's useful for some people, but it might be completely unhelpful for others. And honestly, a single tool is never going to be enough for every single challenge you encounter on your journey.
Finally, Section 6, the honest hierarchy.
So, how do we establish a practical framework for ourselves? Well, if you're dealing with mild stress, a bit of bedtime restlessness, or you just want a nice, calming daily routine, self-selected ASMR is a fantastic low-risk experiment. Go for it. But if your sensory issues are causing functional impairment, meaning they're actually messing with your hygiene, your safety, your ability to sleep and eat, or they're disrupting school, work, or emotional stability, that is a clear, undeniable sign that it's time to seek professional therapy. To make sure we're taking care of our health responsibly, we have to establish a few really firm clinical boundaries. Let's be crystal clear. ASMR is not sensory integration therapy. It is not occupational therapy, and it is absolutely never a substitute for an individualized clinical evaluation. We have to be super careful not to conflate a wonderful, helpful media habit with actual medical treatment. But there is one beautiful, truly empowering thing about self-selected media that we have to highlight before we wrap up. The person using the sound always gets control. You get to decide what works for you, when to turn it on, and when to turn it off. You also control exactly how it's delivered. And this is absolutely vital, keeping it at a safe volume to protect your hearing long-term while still getting that sensory input you need. That kind of autonomy is essential for personal comfort when you're exploring tools on your own. So, as we bring this explainer to a close, I want to leave you with a question to really chew on. Based on what we've covered today, would you describe your own use of ASMR as relaxation, sensory support, focus help, or something else entirely? Because really, understanding your own habits is the very first step to building a sensory toolkit that truly works for your daily life. Thanks for diving into